If you have plantar fasciitis, the treatments you've tried have probably been focused on the bottom of your feet, the plantar fascia itself. But most cases of plantar fasciitis are a symptom of a full body pattern of tension that starts in the lower back. And no amount of rest, icing, stretching, or wearing arch supports will cure your plantar fasciitis if you don't address the larger pattern of tension that's causing the problem. So let's talk about how tight muscles in the lower back are connected to the plantar fascia. Our muscles, tendons, ligaments, and bones create a complicated pulley system throughout our body. No part of our body moves independently. Movement or tension or misalignment in one part of the body always affects and involves other parts of the body. When it comes to plantar fasciitis, tight muscles in the lower back, the quadratus lumborum and the erector spinae group, pull the top of the pelvis and lumbar vertebrae closer together. This brings the pelvis into an anterior tilt or forward tilt. Tight hip flexors will also tilt the pelvis forward, and they often play a role in plantar fasciitis. An even amount of tension across the lower back might translate into plantar fasciitis pain being experienced equally in both feet. But many people have one side of their lower back or one hip that's tighter than the other. An imbalanced pattern of tension in the lower back muscles, iliopsoas, and even the obliques can result in plantar fasciitis pain being experienced more in one foot than the other, or only in one foot. So when our pelvis is tipped forward, or when one hip is hiked up, our hamstrings get pulled tight. Our hamstrings originate at the bottom of our pelvic bone, run down the back of our thighs, and insert at the tops of our tibia and fibula, the bones of our lower leg. This tension in the hamstrings pulls on the bones of our lower leg, trying to flex or bend our knees. This attempt to flex our knees recruits the muscles of the lower leg that flex the knees as well, the gastrocnemius and the plantaris. These muscles attach to the calcaneal tendon, or the Achilles tendon, which attaches to the heel bone. So when these muscles are tight, they not only flex the knee, but also plantar flex the ankle. This finally brings us to the plantar fascia. The plantar fascia is a thick band of connective tissue that runs along the underside of the foot, from the heel bone to the metatarsals. Its job is to support the arch of the foot by carrying tension when the foot bears weight. When the ankle is plantar flexed, the muscles and connective tissues on the bottom of the foot are tightened. This can lead to the plantar fascia becoming inflamed, degenerate, and very painful. So if this pulley system I've described is chronically tight, and if we spend a lot of time on our feet, pain in the plantar fascia is almost inevitable because it's bearing the weight of the entire body while at the same time being pulled tight. So most common treatments for plantar fasciitis are focused on the bottom of the feet, but those treatments usually don't have lasting effect because they don't address the entire pattern of tension. But researchers are starting to look at the relationship between plantar fasciitis and pain and dysfunction in the lower back. There was a study published in 2017 that explored the association between lower back pain, lower back dysfunction, and plantar fasciitis. The researchers hypothesized that lack of response to plantar heel pain treatment may be related to unmanaged low back pain and low back dysfunction. The study found a significantly higher rate of lower back pain among people with plantar heel pain than among controls. The researchers concluded that treatment to address lower back pain and disability may be helpful in order to successfully improve plantar heel pain. The most effective way to release chronically tight muscles in your lower back and legs is with a movement technique called pandiculation, which is taught in Clinical Somatics. Pandiculation reduces the resting level of tension in your muscles being set by your nervous system. The exercises retrain your muscle memory, allowing you to change your deeply learned posture and movement patterns and stop doing damage to your body. In 2022, a study of pandiculation was published in a peer-reviewed journal for the first time. Researchers evaluated the effect of practicing pandiculation exercises in 103 patients with chronic lower back pain and/or neck pain. After completing an average of just 2.8 individual sessions, followed by practicing the exercises at home, the patient's lower back pain was reduced by 81%, and their neck pain was reduced by 80%. So this is the type of neuromuscular education that I teach in my online courses. Here are the exercises from my Level 1 and 2 courses that most directly relieve plantar fasciitis. But there are other exercises that will be helpful as well, depending on your unique full body patterns of tension. In addition to practicing clinical somatics exercises on a daily basis to release your muscle tension and retrain your posture and movement, you should also Vary your activities and types of exercise so that you're not overusing certain muscle groups. Vary your footwear and don't wear high heels. You may even find it helpful to change your footwear throughout the day. If you spend a lot of time on your feet, try to reduce it. If you can't avoid being on your feet at work, try to take frequent breaks and put your feet up. Put your legs in the air against a wall. This is great for circulation and it helps to relieve swollen, inflamed feet. Stop doing any deep, static stretching of your back, legs, and feet. You can read this article to learn why static stretching doesn't work and can actually make your muscles tighter over time. I'll include this link in the video description below as well. And if you want to learn more, you can read my book, The Pain Relief Secret, which is available on Amazon, and you can visit my website, somaticmovementcenter.com. Thanks for watching.